I'm Danica Vendiola. I'm graduating this year. I'm matched into pediatric residency and I'll be starting this upcoming June. And I had joined the whole team this past February in Iloilo for the medical mission as a medical student. I'm graduating from Medical College of Wisconsin, so not too far from here. And I'm really happy to present kind of my reflections and everything that I've learned during this time. So next slide. So I had started my medical school career at MCW in the height of COVID, actually, back in 2020, in which during that time I had volunteered at the Philippine Cultural Center Free Medical Clinic. And during this time, I had truly learned what it means to really roll with the punches and really think on my feet. I remember that the Philippine Free Clinic, during COVID, we had to triage our patients outside because there was that level of uncertainty and things had to be a little bit spread apart, and we still kind of made the best of our circumstances and our situations to ensure that patients and volunteers were safe. During that time then, I continued as co-president for the Medical College of Wisconsin liaison for the Philippine Cultural Center Free Clinic, where I not only volunteered often, but I served as a liaison to recruit very caring and mindful future physicians who wanted to give back to their communities. And during that time, I took an extra year in my medical career for exams. I had spent it with Dr. Violeta SIngson in her pediatric clinic. And she introduced me to the PMA-W board and invited me to come to the 2025 medical mission on the SIngson Medical Scholarship, where travel would be funded. So, next slide. Perfect. So from serving the Milwaukee community to crossing oceans and giving back to the motherland, or my motherland technically, yes, thanks to the SIngson Medical Mission Fund. While this was not my first time visiting the Philippines, my family being from Dumaguete over at Negros Oriental, this would have been my first time ever serving at a medical mission in general, and it being back in my own mother's homeland, it was very meaningful during that time. So while aiming to match for pediatric residency, I was really excited to serve the community of rural Iloilo and to learn alongside the nurses and pharmacists and physicians there. And I'm so proud to have been able to do that as a recipient of the SIngson Medical Mission Student Fund Scholarship. This fund that was established during the PMA presidency of Dr. Mario Montalvo in 2019 as a tribute to Drs. Juanito and Violeta SIngson, as in collaboration with the Medical College of Wisconsin Medical Student Group. And it was initially funded by Drs. SIngson and Montalvo, and Dr. Violeta SIngson has continued to provide the funds, which is a resource to help provide this really awesome opportunity for future doctors like myself, and being able to really cross oceans and be a part of this really well-meaning journey. Next slide. So briefly, day one, where I have I have lovingly called it Garles. That was our day one trip. Garles, where I say controlled chaos, compassion, and calculating dosages. I remembered entering that gymnasium on the first day of our official medical mission, and the doctors, nurses, and pharmacists, we all gasped as we saw the sheer overwhelming flood of lines that were awaiting for us to start our day. And we hit the ground running, and I'd be lying if I said that I knew exactly what to do, because I didn't know exactly what to do. At MCW, and I'm going to generalize that and say US medical training in general, we have the privilege of everything to be automatically automated, the privileges of immediate streamlined electronic medical records that are able to just boom, 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 you have the dosage immediately based off of weights. But we didn't have that in rural Iloilo. So when I would get the medicines and they tell me how much, I'd say, I don't know, because I've never learned. I'm so thankful then during that time that while I was a little bit frazzled and overwhelmed, realizing, wow, I really need help, we had a physician with us, a rural health physician trained in the Iloilo College of Medicine, that really came to my rescue, Dr. Stara Lusaya, and she taught me so much within these clinic hours, showing me her calculation sheet, showing me the nitty-gritty of how to look at the weights, calculate it, how to do this, how to do that. Something that honestly, I would say medical students, I mean, I didn't get the training because I didn't know what to do first day, so I would say a lot of medical students in America don't necessarily get that training. And it was very valuable to me to understand what to prescribe and how to prescribe it. So I think that was one spot that was very, very awesome for me to learn. Next slide. Day 2 in Sara, from scabies to staff and gaining new mentors. I had the privilege to begin learning on hand by the lovely pediatricians, Dr. Belmonte back in Iloilo and Dr. Bisaya. I learned how invaluable, above all else, your physical exam will always be, especially in a community where imaging is limited, labs are few, and resources can be hard to come by. You learn how to hone in on those skills, and I hope to become the type of pediatrician Dr. Belmonte and Dr. Visaya are. And I was able to see so many interesting cases that otherwise I don't think I would have been able to see at Children's Hospital of Wisconsin. And it was very early in this trip, for example, just how prevalent things like malnutrition within these children are, things like resources, things like as simple as a multivitamin that these parents wait in line for that can mean the difference for them. Next slide. Perfect. Day 3, San Dionisio, confident decision making while beating the heat. So day 3, I had already seen an incredible amount of pediatric medical cases that will shape me into my future career as I think about how I felt halfway through that medical mission. And I was more confident in myself. I trusted my instincts more. I knew how to calculate at that point already at that time. Seeing things like tinea versicolor on a teenage patient, well, that's something that I see on a screen for my medical exams. I see it on a person right then and there, and I have to trust my instincts because I don't have Google.com on hand, whatnot, but I have my mentors with me throughout this time. The things that I learned above all else is that the love of a parent knows no borders. From the USA to the East, the sacrifices families will make from waiting in line for how many hours during these clinics that we held in the heat just so that their children can be seen for a multivitamin, for something else, was really inspiring and very sobering when I see how many of the families came from very unfortunate circumstances. And I remind myself that on what Dr. Toledo had said right at the beginning of our trip, that what we do is simply a starting point. It is a step for families and people to at least get towards the right direction. Next slide. And day 4, day 5, the last final 2 days at Concepcion and Tambalisa, a humbling and a life-changing mission trip. So day 4 and 5, where we spent our clinic at Concepcion and the remote neighboring island of Tambalisa, I felt this immense gratitude of the patience and trust that my fellow volunteers had for me, because I was just a learner. And from starting out as a student who truly felt like first days of my medical rotation all over again, to then a self-assured 4th year going on to residency now, at the end of the week, I really was taught what patience meant, what guidance meant, and what the kindness of others meant. And I've come to appreciate above all else what a privilege it is that I'm standing here to try to give back all I can. Next slide. So the mission as a medical student was incredibly impactful. It taught me how to think on my feet, how to not sweat the small stuff while you're literally sweating. It taught me to lead with kindness, and it reminded me to remain humble and grateful and keep the passion when I move on to my career as an incoming pediatric intern back in Chicago. On a deeper level, as a Filipino American, it meant the world to connect again with the world and culture and community that raised my parents. I can only hope and wish that more medical students, years to come, have the opportunity to learn alongside such incredibly trained volunteers. Final slide, next slide. So I stand here before you to say, please, please continue to support and fundraise for the efforts that the PMA holds, and please continue to support the Philippine medical missions to come, because I saw firsthand how much of an impact it meant, and truly, if you guys want to make an impact, this is just the start on how you can do that. Maraming salamat. Thank you so much.